And also we were working with an architectural partner of ours on commissioning some international schools in mainland China. And obviously all those things got put on hold. So we started looking at ways to help schools safely reopen from COVID-19 really before it broke here. But we really thought we were going to be looking at specifically facilities. It grew and grew and grew. So we have created the Clean Slate program. This webinar is another in a series of webinars that are in support of that Clean Slate initiative. Clean Slate is no cookie cutter version of any program like this, because every school is different, every geographic region is different, every state is going through their own systematic response to this. So Clean Slate is designed to support the initiatives that you guys have created in your schools, review the plans that you have in place, and kind of run the traps and compare those plans to recommendations made by the CDC, Department of Education, organizations like APA and ASHRAE and AIA, all of these organizations that have put out recommendations on social distancing, air handling, cleaning and sanitizing. So we look at all of these factors and then really look at how they're going to affect the use of your facilities, the distribution of the staff involved, keeping the staff safe, creating some best practices, and then calculating a financial impact so that you can understand that, yes, we had a budget, and here is our budget, here is the impact of COVID-19, and really trying to be as granular as we can on that, not just oh, you have to buy more cleaning supplies, but knowing that the frequency of buying your cleaning supplies is going to go up, the type of cleaning supplies, apparatus you may have to buy to apply those products, more full-time equivalents, because you're going to be setting up and repurposing space. Maybe you're using your gym for kindergarten in the morning and for dining, extra dining space in the afternoon. You're still going to have some sort of athletics there in the evening. So lots of things to consider. Certainly, we're not doing this on our own. We've assembled an advisory council of professionals from healthcare, building systems, commissioning, design, education. We've got any number of professionals that would be appropriate for a school to engage during a crisis like this, and they're from all over the country. We didn't want to have a Texas flavor to anything. We certainly wanted to be able to serve everybody. So Dr. Shoup is on that advisory council, and I'm going to let Bill tell you more about her. At the end of this, you'll have some contact information up. If you have questions about Clean Slate in general, or questions for Dr. Shoup, please, that's what this forum is for. And certainly make the other schools in attendance in the webinar feel at ease that everybody's going through the same rigmarole here. So hope you guys enjoy this presentation. Bill.
Thank you very much, Joe. Dr. Shoup, while I introduce you, why don't you go ahead and put up your presentation. So today we're talking indoor air quality in response to COVID-19. And today we're excited to have Dr. Valerie Shoup as our presenter. Dr. Valerie Shoup is president of Heritage Institute of Sustainability and a versatile executive leader offering a proven track record of achievement in sustainability, energy conservation, research, education, and hospital administration. She has an extensive background in healthcare design, operations, construction, and maintenance. She also delivers expertise in HCAHPS score and quality improvement and experience in academic, healthcare, and corporate environments. Dr. Shoup has received multiple awards and honorariums for her work, including D Magazine Excellence in Healthcare, STARS Award for Excellence in Materials Management, working for Clean Air Award for Best Business Operations, and TCEQ Innovative Operations Finalist. She has presented multiple papers, both nationally and internationally, on topics including engineering, sustainability, and healthcare. Dr. Shoup's passion is creating a sustainable environment for current and future generations. I welcome Dr. Shoup to the floor. Thank you everyone for being here. Remember, this is as interactive as we want. If we have questions, we'll encourage those questions to be asked. Just unmute yourself and just say you have a question, and we'll get through. And then we'll, at the end of the presentation, we'll also have the opportunity for more questions. Dr. Shoup, the floor is yours.
All right, thank you. Can everybody hear me? Can I just see a thumbs up if everyone can hear me?
I can hear you.
Great, perfect. Thank you so much. Well, thank you so much for having me here today. As Bill said, I'm absolutely passionate about making the world a better place and honestly safer for everybody in it, including all of our children who we send off to school every day. So today we are here to discuss indoor air quality and the technology available to address indoor air quality issues. Treating the air generated by your air handling unit is just as important as cleaning your facility. And in this presentation, we will show you why. The CDC reports over 13 million flu cases in the 2019-2020 flu season. And as you can see, there are times when the number of deaths spiked due to the flu. Many people go to work when they are ill thinking it is just seasonal allergies. Because of this, we have issues of spreading illness in the workplace, in schools, and in other places. Okay, so let's talk a little bit about technologies typically used in air handling units. So UV lights and filters are typically used in air handling units and have been proven to be very effective in capturing and or killing microbes and various particles. However, both UV lights and HEPA filters are constrained by the same challenge. The pathogens must travel to the filter or UV light to be effective. In the case of UV, only that which is located within 8 inches of the light source is eradicated. With a filter, you are capturing and accumulating particulate matter buildup after the pathogen arrives. Neither of these technologies was designed to address odor and or mold issues. They are passive technologies as they must await the microbes' arrival to deploy. Additionally, UV lights require switches that cut them off when the air handling unit door is opened, or they can cause harm to the person working with the UV lights. And changing UV lights and filters is an expensive proposition. So let's talk a little bit about filters. I hope to help you all understand the difference in some of the filters and how you want to go about selecting the filter for your air handling unit. And before I talk specifically about filters, I want to be sure you all know all air handling units, the air bypasses the filters. There is some bypass. Some filters are better than others, some filter racks are better, and some are not quite as good. And that is why coils get dirty. So before you even think about what type of filters you have in your air handling unit, you may want to look at how much bypass you have and see about sealing up around the filter banks. Second, it is very important to pay attention to what type of filters you have in your system. Now, when you purchase air handling units, they normally put in filters that are the minimum. They could be as little as a MERV 4 or 5 filter that you purchase with your air handling unit. So another thing you want to consider when you purchase new air handling unit is ensure that you get at least a MERV 11 filter. Now, if you look at this chart that I have up on the screen, as you can see, until you get to MERV 14, you are not essentially not capturing any of the smaller micron pollutants, such as smaller dusts, bacteria, and viruses. So this is really important for you all to understand, is which filters capture what. And in order to help take the mystery out of what size micron is my contaminant, I have this chart here. As you can see, the smallest micron sizes are the viruses. Tobacco smoke, cooking smoke, grease. When you have a vehicle park outside and you're getting the smell of the exhaust, these are all in the very small microscopic sizes. As you can see, as you get larger, we have the bacteria is larger, as well as some ducts, pet dander, insecticides, and so on. So, where are the common germs located? So viruses can generally be categorized into 3 groups by virus structure. Now, the folks who have the viruses are normally not inside the air handling units. They are in the space. So what exactly are they bringing into the schools? Well, influenza A is an example of one virus. It's an envelope virus, and it's the easiest type of viruses to kill. Then we have large non-envelope viruses and small non-envelope viruses, which are increasingly difficult to kill. And I was just speaking to a school administrator last week who was telling me about an outbreak of norovirus in their school and the steps they had to take to try to clean and disinfect the school to stop the spread of norovirus. So we talked earlier about active and passive technologies to address air purification. Bipolar technology, bipolar ionization, is an active air purification system. This active air purification system has been documented a kill rate of norovirus of 93.5 in 30 minutes. So, as we had indicated earlier, norovirus is one of the hardest types to kill. Microbiologists believe that this active air purification would kill coronaviruses at a higher rate. And yes, testing confirmed this theory. So there was actually a third-party lab that tested coronavirus in a gas chamber and determined that bipolar ionization would kill coronavirus. So I wanted to compare and contrast a little bit bipolar ionization to UVC, because oftentimes people ask me, what's the difference between these two technologies? Well, the most important thing about bipolar is that it has no replacement interval. So once you install it in your air handling unit, it is there and you don't have to replace it. It does not produce ozone. It kills mold, bacteria, and viruses. It kills pathogens in the space where UV only kills what is close to it. Bipolar ionization also controls odors, and it has no harmful byproducts. It reduces particulate, and it also does not contain mercury. It's not fragile. There's no shock related to it, and there's no hazardous disposal required. Okay, so we need to share a historical perspective for this technology. As we know, necessity is the mother of invention, as was the case for NASA, when confronted with the challenge of assuring our country that they could place our astronauts in very confined spaces for extended period of time and assure they would not get sick. To solve this constraint, they took a pragmatic approach by reviewing Mother Nature's approach to safe, clean air. So why is the outside air fresh? Well, if you think of the sun as the ultimate UV light, it combines with the naturally occurring metals in our atmosphere, thus creating hydrogen peroxide. NASA had to figure out how to bring the outdoor air equivalent inside. And that is what ADCO Technology represents. Now, some of you all may have heard about ADCO Technology. So ADCO Technology takes UV in a tube and it mixes it with precious metals to be similar to the outside air. And it is proven an effective method to reduce odors, allergens, bacteria, mold, viruses, VOCs, and so forth. But I want you also to be aware that some folks are concerned about this technology because it does produce low levels of ozone. But ADCO Technology uses like the bipolar technology, except with ADCO you do have UVC as well. So in the ADCO technology, it works the same way as bipolar in that it sends ions out into the space that actually cleans the space and goes and attacks the odors that occur in the space. So that is the difference between the active technology and the passive technology, is that active technology actually goes into the space where passive technology is anything just sitting in the air handler. Now, once again, let's talk about bipolar ionization. What exactly is it? So there's carbon brush nodes that split the water vapor in the ambient air into polarized ions, which are proactively dispersed. It's an effective and proven method to reduce allergens, dust, bacteria, mold, viruses, static, and VOCs, and it does not require air to pass through the chamber to be effective. It removes the concern of incomplete oxidation and slow airflow rates, which can be seen around some other technologies. It's highly effective against viruses, bacteria, and mold found on surfaces, and it's more effective against particulate pollution than ADCO, and it requires no maintenance. So what does it look like? Bipolar technology basically has an ionization strip that is placed in the air handler on the upstream side of the coils. The ions then go through the coils, cleaning the coils, cleaning the ductwork, and they find their way out into the space. So anything over 10 tons typically receives an ionization strip. Units less than 10 tons have a smaller compact unit. So,
Dr. Shoup?
Yes, sir.
Sorry, I have a question. Is bipolar ionization an equal replacement of outside air where units do not have outside air?
So bipolar ionization helps compensate for a lack of outside air. I've never been a proponent of zero outside air. However, if you don't have outside air, what is nice about bipolar ionization is the ions go into the space and neutralize VOCs and other pollutants that are built up in the space. Did that answer your question?
Yes, ma'am. Thank you.
Okay, thank you. All right, so actually, Global Plasma Solutions is one of the manufacturers of bipolar ionization. And just in June, they had a third-party lab test their equipment against COVID-19 to determine if it was effective, and it was definitely proven to be effective. Now, I can tell you that in my career, I've used bipolar ionization. I've also used ADCO technology. Now, I prefer to go with bipolar ionization because there's, zero chance of anybody complaining about anything about it. And I also like the fact that you do not have to maintain it. Like the ADCO, you might have to replace the ADCO cells yearly or every couple of years, but with bipolar, you don't have to.
I do have a question about your third-party lab. Who was it?
I can look that up and email you the answer to that question.
And also, when you talk about the 30-minute kill rate, at what distance was that tested at? So, because we do have concerns about it, and
yes, yeah, I know. I remember when I read the test, it happened. You know, they do these things in test chambers, right? So they take a box, basically a test chamber, and they put the virus in the chamber, and they also put the technology in the chamber.
I fully understand that, and what I do understand is that we rate things over turnover rate, and I would have to turn over my system about 10,000 times in order for that to be effective.
Well, what I can tell you, as long as your air handling unit is running, the bipolar ionization is creating ions. So the ions are being continuously created. And you make a very good point about the ion efficacy. Not all manufacturers have the same ion efficacy. So what you need to find out about your particular, whatever the system is you purchase, is how many ions is it actually putting out? Because obviously, the more ions you're putting out, the more effective it's going to be, especially in more dirtier environments, such as locker rooms and that type of thing.
And also, I've also read that it in fact does create ozone, just low levels of ozone.
Not the bipolar ionization. The ADCO does, okay, but not the bipolar, because they actually have an electron volt measurement in the system that runs the ions at a rate such that it will not create ozone.
So we're relying on the technology to operate correctly, and if it doesn't, then it will create ozone?
No, this technology will not create ozone. Not at least the manufacturer I have been working with on all of my projects is Global Plasma Solutions, and I know it does not create any ozone. And in fact, I specified in every single system that I design. I put in MERV 11 along with bipolar because of all the benefits of keeping the coils clean as well as the space.
Thank you.
Excuse me, I have a question. When you were talking about comparing UV with bipolar ionization, I did my research as well, and the bipolar one, you can't really say there's no maintenance involved, because there is maintenance. And one of the things I was reading about, and maybe you can confirm, is that maybe there's no direct maintenance, but because of the way that the system works and the particles of hydrogen, I believe, are separated, that means that the air filters get dirtier more often and therefore require more cleaning more often. So in terms of maintenance, when you're comparing systems, UV versus bipolar ionization, you have to consider the fact that you're going to have to clean the air filters more constantly. Is this correct?
Okay, Carlos, that is a great question, because the great thing about bipolar is you'll actually have to clean the filters fewer. Now, why less often? Now, why is that? Because when the ions go out to the space and they attach to the bacteria and the VOCs and those things in the space, actually that stuff drops out in the space rather than being carried back to the air handling unit. So what you should find is that you actually have to change your filters less often with bipolar ionization than without it.
But if, sorry, a follow-up question, but if the bipolar ionization, the modules are located in the air handlers, how are those particles not staying in there as opposed to, I'm just a little bit confused as to what's going on in the air handlers and the ducts versus in the spaces themselves, and where the particles are going.
Okay, so when you think about it, the bipolar ionization strips are upstream of the coils. Now the filters are upstream of the bipolar ionization, right? So because the filters are seeing the mixed air, the return air, the outside air. So the air is coming in, it crosses over the ionizer, which is ionizing the coils. And the thing that's nice about the ionization of the coils is that when you clean the coils, especially when you have a 6-row coil, you can never get to the center of those coils to clean them. The ionization, the ions are going through the coils, and the bacteria and mold and all that that's builds up on the coils, because you have a wet, nasty environment, it kills all that. So it ends up being just more like dust in the system, right? And then any mold and bacteria that's built up in your ductwork, it's killing that as well. And when it gets out to the space, the pollen and the other molecules in the air, they basically drop out. And so your housekeepers, clean that up when they vacuum or whatever in the space, as opposed to all that stuff being carried back to the air handling unit. So that's how it works.
So just to summarize, the particles, I mean, the maintenance is more involving the dirt or whatnot is on the surfaces of the spaces and not back into the ductwork and the filters.
That's correct. Okay. The other thing that's nice about the ionization is, as good as our housekeepers are, and they work very hard, and I would never say anything bad about housekeepers because they're awesome, but they can't hit every single space every single time, right? And people are continually going through spaces, touching doorknobs, touching things in the space, and the bipolar ions are actually killing stuff on surfaces. And that was an example I'm getting ready to show you all. So did that answer your question? I didn't mean to cut you off, Carlos. Are you good?
Yes, no, it does. I just, I'm trying to evaluate different systems, and there's always a catch. There's no perfect system, and whenever I see no maintenance, I get a red flag, a light bulb. So I just want to identify what the maintenance of the bipolar ionization filter system is, and what does it involve?
All right. Well, the system. So I can tell you, I actually have one in my air handling unit at my house, and so it's less than 5 tons. So it's kind of it's only a 2-pronged system versus the strip that goes in a big air handling unit. So basically, when I go in there once a year to check out the unit, I just flick the dust off the probe. I mean, basically that's it. There's really nothing to it. And the other thing is you won't have to clean your coils as often. As long as your filters have bypassed, you're always going to get dust and stuff through them, clogging up the coils. But you shouldn't have to clean your coils as often. You should be able to reduce the number of cleanings per year.
I do have another question. So wouldn't you want your filters to capture all that stuff instead of it kind of floating down low in the atmosphere, such as where kids are actually playing on the ground? I mean, if you're making it heavier, it's going to be where most of my children are at school. So it's going to be putting them potentially onto the surfaces during the course of the school day. Is that true? Or
but remember, these ions are now they're no longer active. They're no longer active viruses or bacteria or whatever, because the bipolar ions have attached themselves to these other ions and basically neutralized any harmful effects from those other ions. Let me show you this case study I'm getting ready to show you, and so you can kind of see an example. This is a high school in Dallas, and so we did testing 2 ways. There's many ways to test, but this is just 2 ways we tested. We used adenosine triphosphate. That's an enzyme that's present in all living cells. And we monitored various surfaces at the school. So we selected a high school locker room. And as you can imagine, not only the odor experience during this test, but the actual organic matter findings were not pretty. So we actually did swab ATP touch points on football helmets, lockers, shoulder pads, walls, and door handles on this in this particular school. Okay, the first test, day one, these are the ATP metering results. Basically, this is telling you what kind of organic matter is growing on these various surfaces. Test 2 was after 30 days of running bipolar ionization. As you can see, that in all cases, well, except the side of lockers, all the other cases, the organic matter was significantly reduced. Now, while this does not show, this doesn't, you know, obviously capture everything in the air. I mean, there's other ways to capture the air particles, but I kind of like this as a visual because when you open a Petri dish in your school, and I would encourage you all to go into the various spaces in your school and have some Petri dishes, open them up and set them down and leave them for an hour. And that's how I did this test. After an hour, you close up the Petri dishes and you take them and you put them in a dark place. And every few days, look at them and see what they look like. So this is over time, you can see that as we tested and retested, the number of mold and bacteria ions that are located basically in the air, because you're just opening this up and exposing it to the air, they decreased. In air handling unit 2, this was the final test on that unit. So do y'all have any questions about that? Okay.
Well, sorry, one question in terms of testing, because I'm no doctor, I don't know a lot about that, but the type of test that you perform for air quality in terms of COVID-19 or viruses in specific, because I don't think if ATP is present in viruses or coronaviruses.
No, it's not. No, it's not. And clearly this is not the kind of test to identify viruses. That would be very specialty testing. And this won't do it. I think, in my mind, this is more qualitative in nature. Because like I used this test when my chiropractor was complaining about the mold in his office, and we ran the same test and we had all kinds of more mold spores growing. We put in bipolar ionization and we went back and there were none growing anymore. So the reason I am so sold on this technology is I have done enough tests for enough people and seen the results over and over again. So I'm a believer. I'm just saying.
Well, just on that, as I think a lot of people here also, we have to answer to school parents who are going to want to know, how do you measure how safe the air quality is? And so if a system like bipolar ionization is the way to go, then how do we prove how effective it's being in an environment?
Well, here's what my suggestion would be. I know there are professional air testing companies. So we have them in Dallas. I mean, they're all over the country. What I would do before, say, you implemented a widespread indoor air quality thing with bipolar is take one location. Take one location and bring in a third-party consultant to measure the air. And then I would implement it on one location, like if you have a gymnasium or something to that effect, because there's lots of gunk in there from all the sweat and stuff of the kids. you know, have an indoor air quality consultant come in, test, and before and after, and just do one air handling unit so that you can be satisfied that, yes, this will work, you know, so you personally are satisfied it will work across your entire organization. I didn't have, like, on these particular jobs, a third party come in and test, but what I can tell you, the way I originally got sold on this was that when somebody told me about it, I didn't believe them either. I didn't believe them. So the gentleman gave me a portable unit to put in my house. And so I ran it in my house. Now, I keep a clean house, so I really do, but I have 4 dogs, and I have a daughter who is like so sensitive to the smell of dogs. I mean, she is just like super sensitive. So I'm running this in my house, and I was running it for a few days, and then one day she comes over for a cup of coffee. And I'm sitting at the kitchen table telling her about this technology. And I told her, yeah, I've been running it in the house. And she goes, Mom, I knew there was something different about your house. She says, it doesn't smell like dog. So I know that's not scientific, but all the tests I have run, when I get a Petri dish that comes out black and I put in bipolar and it comes out clean, I know it's doing something, but I understand that you need to prove to administrators. So I would totally suggest, you know, just do one space where you feel like that the air, you know, is separate from the other spaces, and see what you feel like your results are. I can tell you also, like one of the schools, we put it in the infant room, you know, because you have the babies and diapers, and, you know, and the room doesn't smell all that great, but we put it in their air handling unit. And honestly, I mean, you could tell a difference in the odors in the air just having this in there. And something else I want to mention, so several people that I've sold it to that they put in their homes, they'll tell me that, like, one of the things I notice, like if I cook and say I might burn something a little bit, the smell goes away very quickly in your home. So I know these are all anecdotal, but I've had so many of the same types of results that, I mean, and so that's why I'm totally sold on it. Plus, I've seen multiple studies, third-party studies done that verify the findings. So anyway.
Dr. Shoup?
Yes, sir.
And we have one more question, Mr. David Marcus.
Valerie, we looked into the needlepoint bipolar and really liked it. Especially one of the things was exactly that, the elimination of odors. But it was a little bit cost prohibitive right at this minute. My question to you right now is, why would anyone not want to go with bipolar? Why would someone want to go with UV? And what's the price difference between the two?
Well, what I can tell you is I don't know why anybody would, personally, I don't know why anybody would go with UV. So I worked at UT Southwestern for 16 years running hospital facilities. Okay, and so before I was aware of bipolar, we did put in UV. And what would knock your socks off is those lights just did not last. And when a certain large air handling unit company who sold it to us came in and told us replacement bulbs were $20,000, and then, oh, by the way, you're also, you have the disposal fees. Honestly, I can't imagine why anybody would not go with bipolar ionization. And the other thing is, basically, if you put bipolar in with, say, a MERV 11 filter, it's the same, you really are getting the same results as you would with a HEPA filter without having to pay the price of an expensive HEPA filter, changing that out. I mean, because you know, the higher the MERV on the filter, the more expensive they are to change out. So I'm a proponent of MERV 11 with bipolar, and Yeah, that's a good question. I don't know why anybody would go with UV, honestly. I wouldn't. I personally would not.
Thank you, ma'am. That's all the questions for now.
Okay. Okay, thank you. So what I wanted to show you was an IAQ calculator report that comes with you can have that run on your facility based on like how much outside air you have and so forth. But what this shows in the first column is the maximum threshold value limits of acceptable limits for these various gases. Now, when we bring in outside air, you know, the prescribed amount, 5 to 10, some people do 15 CFM a person, you can see that it actually dilutes all these indoor contaminants to acceptable levels. But what I wanted to show you is, remember, the outside air is not only always clean. In Dallas, for instance, we have many ozone alert days. We have high pollen count days. And hopefully your filters will capture that, but as we all know, all filters bypass. So if you have bipolar ionization, what you can see is you can allow the carbon dioxide to go up a bit and still contain all these various indoor contaminants. And what that means is that you can actually reduce your outside air volume when you have bipolar ionization. So what I do when I specify systems, I specify CO2 sensors to be installed in the space, and we will adjust the volume of outside air based on CO2. And as you know, depending on what state you're in, outside air can be very, very expensive to temper. So depending on what state you're in, you will see differing levels of payback on this. But I can tell you down in Texas, where when we are running the AC all the time, the payback is honestly not all that long. Okay. So West Texas A&M University did testing on bipolar ionization. And these are the types of results that they found on various contaminants, viruses, bacteria, mold, and odors. So the technology has been extensively tested. Now, I'm really just a consultant. So I really use this on every system that I design, and I also do third-party review for many facilities, schools, and I always recommend it because I feel very comfortable with the technology. The other thing is, why would NASA use it on spacecraft if they didn't think that it was worth having? The US military uses it in various facilities. I can tell you the White House has bipolar ionization installed in their air handling units. So the main thing about it is beyond the elimination of the pathogens, odors, and mold, it really is an exceptional monetary value. Why is that? You will have less coil cleaning. On any units bringing in outside air, you can potentially lower your kilowatt hour consumption. You will also reduce your dependency on outside air. It should extend your filter life. Now, they have claimed reduced student absenteeism, but I really haven't found anybody who can prove that, because honestly, you can get, just because you go to school during the day doesn't mean you get bugs at night. And I know that, so Arlington ISD here in Dallas has it in every single one of their air handling units, and I'm real good friends with the facilities manager. So they actually opened 2 schools, and just to run a test, we had them put it on one school and then not put it on the other school. And then they tracked absenteeism. and he said they really couldn't see a difference in absenteeism. But what they did see was a difference in the cleanliness, of course, of the coils and that type of thing. So, you know, this is what they claim. I don't know if that's the case or not. But I do know the surfaces and everything are cleaner, and it's a proactive solution. So, I mean, everybody has choices to make. And I mean, you could put in HEPA filters instead of bipolar, but then you remember you're going to have the maintenance that's associated with it. So, does any of this make sense? And do you have any questions for me?
I've got a COVID-related question.
Okay.
We're advised to keep all of our doors open, which means at the same time we're running our air conditioning units. And actually, it's a twofold question. One question is, at what heat or coldness outside do we shut the doors? Is it not worth getting the outside air coming in to freshen things up? And the other part of the question is, when we have outside air coming in, it messes totally with the thermostats and with the cooling function. Any ideas, any suggestions as to making it so that the thermostat isn't going crazy and we're not breaking our systems?
Well, honestly, I think that depending on where you're located, that advice may or may not be good. So it's really a function of the air quality in your area. And also many, many children suffer from allergies. So if you live in an area where there's high pollen counts, you know, honestly, I wouldn't be opening the doors and bringing in the outside air. So honestly, it's really, you know, I think every location would be different. And what I personally would do is consult with a company that actually measures indoor and outdoor air quality, who could probably tell you more your particular area, what they're seeing in regard to air quality. Also, how much traffic is around your school. You know, do you want to be bringing in carbon monoxide? So there's no one answer that will solve everybody's problem.
If I can comment on that, my name is Carlos Rodriguez. I am a facilities manager for a large K-12 school in the Dominican Republic. We've discussed this internally because we're a tropical island and it's hot all year round probably. And most of our classrooms lead to the outside. There are a lot of disadvantages to leaving the door open because of air particles, like the doctor said. The filters would get dirty more often. And if we're doing this work on either bipolar or UV or whatever system, it's that you're treating the air. You're making sure that the air inside is treated. If you keep the door open, then you're messing up with that in a way. So our conclusion was that as long as we make sure that we treat the air that's inside, we don't have to open the doors or the windows.
Right, and also if you're honestly, if your systems, I also design all of my air handling units with free cooling. So if the temperature and such outside, you know, is of the, you know, the right temperature to bring the outside air in, you can actually increase your outside air and still ionize it to ensure that you're killing anything that bypasses your filters.
Dr. Shoup, we have another question. Mr. McDaniel?
Yes, sir. I'd like to know if you have a hydronic heating system. Is there some way that this could also be deployed with maybe a fan or something else to, I'm talking specifically about the bipolar ionization.
Okay, so there are companies that make the bipolar ionization basically in stand-up air, stand-up units. I actually have a small compact one that I take with me to hotel rooms and stuff when I travel. But the thing about the portable ones is always something breaks. I mean, everybody I know who has bought one, probably within 2 years, you've had to replace the fan or something inside the unit. So the portable ones I find are not as robust as the ones that you put inside the air handling unit. But yes, the answer to your question is yes, they do exist.
Thank you, Doctor.
Okay, do we have any more questions? All right, greatly appreciate everybody coming in. Joe, do you have any closing words you wanna say?
Just we appreciate the interaction. Those were great questions. We've been standing on our heads to get webinars as part of Clean Slate out to help you guys. If you can think of topics that you think would be helpful, please, email them to Bill Dillard, email them to me, call us direct. There's our contact information. Please write it down. We have all kinds of information on our website. I'll tell it to you quickly. It's www.building.solns.com. And if you add the /clean slate, and we'll follow up everybody that attended with an email. But if you add that /, you'll have access to a wealth of information, articles on return to school, ASHRAE recommendations, APA, AIA, Department of Education, CDC, WHO. We've tried to be real thorough, and we've also read through everything that's on there and culled them out for appropriateness and accessibility, feasibility. So please use that as a resource. And if you're feeling bogged down in this, man, that's why we're here. That's why we created the program. Reach out to us. It all starts with a survey that takes you about 5 minutes, maybe 10 minutes to fill out. And from there, we can make recommendations and a proposal to review the processes you have in place. So we appreciate everybody's time today, especially Dr. Shoup, great member of our advisory council. And hopefully we're not wearing those guys out yet.
Thanks, Joe. And just so the question came a couple of times about the video being recorded and the slides being available, we will have the recording posted on our website. As Joe said, buildingsolns.com/clean-slate. And we'll also have the slides available for y'all's reference. Thank you, Dr. Shoup, for participating and leading this conversation. Thank you, everybody, for attending and also for your wealth of questions. It was fantastic discussion, and we're excited about seeing y'all again on the next webinar.